Dr. Rafi Romano, that will speak to you about Froggymouth and explain you why it is an essential tool to correct and retain tooth position at any age. Dr. Rafi Romano is an Israeli orthodontist that was studying at the Jerusalem University. He is the AAO ambassador of the Israeli Orthodontic Society. He was the editor of 5 different books about orthodontic, focused on especially aesthetic orthodontics, but actually all kinds of orthodontics as well. He's an international speaker that is having really, on my opinion, such a charisma, and that's why I am so glad to introduce him, to have him at my side. And I have to say that it's one of the lectures that I was really proud to be able. We were not yet having the chance to meet in live, Rafi, but we were exchanging a lot during the past months, years, and I have to say that I was really appreciating your clinical view. Very important to explain why in aesthetic treatments, the treatment of relapse and actually of not having relapse, how to maintain the result is so important, and what Froggymouth device or other functional rehabilitation can bring to all kinds of treatments, orthodontic and aesthetic. Rafi, I let you share your screen and start your lecture. Thank you so much to be here with me and with us.
Thank you, Guillaume, and thank you, Gabor, for your wonderful lecture. I really enjoyed it, and we know each other for many years. And thanks for Froggymouth Israel, the team of Israel, which I had the pleasure to introduce to Professor Felus a year ago, and now Froggymouth is part of the daily routine of orthodontists in Israel. So my topic today will be on how I use Froggymouth in my office. But as Gabor mentioned, you know, IFUNA is the whole concept of functional and orthodontics, which I believe, as my friend Eyal Botzer is with us today, we discussed it for many years. Most of the clinicians are not taking into account the whole concept and just focusing on their own problems and not on the whole picture. As Guillaume mentioned, I already edited 5 books. I'm now finishing my 6th one, and I'm a member of the European Academy of Aesthetic Dentistry. This is my family, Michal and my 4 kids, and this is my office. I have a very happy team. I think being happy is part of the fact that we like that our patients will be happy from long-lasting results. And this is mainly based on the fact that we retain our results. Now, I quote here an article that was published in 1997 that talk about open bite and the reasons for open bite. As you can see, except the last one, which is true skeletal growth abnormalities, which to me is very low percentage of my relapse and my open bite. The main thing is habits, lip and tongue habits, and airway obstruction. So we have to discuss the etiology. And etiology, of course, one of the first one that should be diagnosed is tongue tie, which Eyal Botzer is one of the leading in the world in investigating and treating tongue tie. And I believe that if it is treated in the right age, it is very crucial for the success. And then, of course, mouth breathing, because, you know, when we hold our mouth open during sleep or during the day, it reflects on all the posture of the body and the muscles. Of course, narrow maxilla, which is, again, you know, the concept of the egg and the chicken. When you are holding your mouth open, your tongue is going forward, then your maxilla is not developing properly, and we have a narrow maxilla. We have consequently a narrow buccal corridors, which of course reflect also aesthetics, and hypotonic facial muscles, and I will discuss what I do with the Froggymouth in my clinic. And of course, habits like thumb sucking and tongue thrust. Incompetent lips and tongue thrust is also something habitual. and patients, even if they have an operation to open their airway and to release their tongue, we should spend time to educate them and exercise how to function in the new environment of a good tongue position and a good muscle tonus. One of the things that we as orthodontists are not paying enough attention is the posture. I believe the posture is one of the reasons or one of the consequence for all the hypotonic muscles. So in our treatment plan in my office, we need to eliminate the etiology. If the etiology is thumb sac, if the etiology is tongue that is always posture forward, we need to eliminate the etiology, regain normal occlusion. And I believe that many orthodontists that send patients first to myofunctional therapists and not regain normal occlusion for the patient, then ignoring the fact that it is very, very difficult for the patient to exercise all the functional exercises when the bite is open and there is no place to put the tongue. So we regain normal occlusion and then we retain the result with the full control. Here I can show you, all of us, I'm sure you will see a lot of case presentations during the day. This is one of the cases I've sent to Guillaume to see. This girl came to me. She is class 3 type. You can see a big open bite. Tongue is forward. Patient has a lot of difficulties to speak and to function. You can see here that during the last years, there are articles describing the benefit of Froggymouth. Unfortunately, not enough articles. I would expect that after some years of experience, and I believe that all the speakers in this Congress can send articles, can publish cases, so that people will have more evidence base in order to relate what Froggymouth is doing. But these are example of some articles. And you can see this patient after myofunctional therapist. You can see, the bite start to close without any appliance, nothing. And this is only after myofunctional therapist. And then I gave the patient Froggymouth. And here she is after 5 months with Froggymouth, and you can see the bite is almost closed completely. Now, I have many cases. One of the things I'm doing in my office, which I love to treat, are open bite. You can see, for example, this patient, which my friend Eyal knows because I referred him to Eyal. That's how we finished the case at age of 14. We gave some buttons to hold the mouth closed. And here he is at the age of 28. And you can see what happened when you do not treat the whole myofunctional concept. You can see that he has a very constricted posterior arch, cross bite, very big open bite, crowding, and mouth is completely open. You can see another case. This patient came to me after failure of 2 orthodontic treatment, not in my office. You can see that by not treating the result, but treating not treating the etiology, but treating only the result, and the orthodontist tried to put here cribs, metal cribs, in order to avoid this tongue thrust, and it didn't help. Because regardless these cribs, the patient developed open bite the 3rd time because there was no thinking about the whole concept. Look at this patient, look what happened to her, look at her face open, you see the tongue popping out, you see the proclination of the teeth. Look over here, this is a combination of tongue thrust and thumb sucking. Most of the time, as you can see, the open bite is asymmetric. It has asymmetry. You can see it's more on the right side than on the left side. It's very important for us to diagnose exactly where the muscle tonus should be addressed. Because if you just give Froggymouth, if you just do myofunctional exercise and not paying attention to the direction of the problem, we are not actually addressing it properly. So you can see here this asymmetry because of the asymmetry of the muscles. You can see here more pronounced. You can see the open bite, which is completely asymmetric. There is intrusion of the lower incisors, intrusion of the upper incisors, and here is a place for the tongue that you can see on the right picture popping out. So for me, diagnosis involves not only taking pictures, but also to do some simulations. Today, we have the option with all the tools that we have in orthodontics is to make simulation. Simulation means that I can do virtually, move the teeth and see what kind of occlusion I can get. And this does not reflect all the functional exercise or the functional treatment that I will do for this patient. So you can see we do all the simulation, we move the teeth, we expand the arch, and we get, after a few minutes, we get a result that show us where we start and where we can get. And this result is based on our vision, which is combined with our function, aesthetic, stability, biomechanics, habits, and experience. We pour into the basket all these points in order to create a simulation which is based on reality and not just on moving teeth in computer. So you can see here, I can also modify the simulation according to my experience. I can add more extrusion, more expansion, and create a plan which we translate into a clean check. With clear aligners, it's very, very simple because you can copy your vision from the simulation into actual plan, put the necessary attachments on the teeth, expand the arch, doing the extrusion, and get a very nice result. So for me, this is first of all, the first thing I need to do is to address the functional problem together with getting a good occlusion. If you divide it to first functional and only then to do the orthodontics, or you do the orthodontics and not paying attention to function, you are actually losing the opportunity to get a result which will be very stable. Now, I do at the end of treatment, as I will show you a few more cases in a few minutes, I do what I call active retention. When I place on the teeth that had the intrusion problem, I place some attachments, palatal attachments, which together with clear aligner at night, actually hold the tooth and do not let the tooth intrude. And also I create some active extrusion for these teeth during the night. I kind of fight all the tendency for relapse that I have later. Of course, you have to add all the functional exercise, which we will discuss in a second. That's another case that I showed you in the beginning. You can see she had asymmetry. She had tongue thrust, which is more on the right side than on the left side. You can see the tooth number 11 is more intruded than tooth number 21 because of the force of the tongue. And you can see the simulation here where I do all the movement. I extrude more on the right than on the left. I correct the midline, I expand the arches, and I get a very good final result, which of course, after you get this result and after you create this active retention that we discussed before, then I can be more focused on all the functional exercises, on all the functional improvement of the patient muscles and functionality. That's another case. Again, I follow the same protocol. I do a lot of functional exercise, which I will explain in a minute. And I do my orthodontic treatment in order to create here a better environment for the tongue to function. If you give here a myofunctional therapist to work, then it's almost impossible because the patient cannot place the tongue properly when she has this gap in the front of the mouth. So first of all, we do everything necessary in order to close the bite, do it with a proper simulation, proper plan. You can see her now, she hasn't finished the treatment yet, but you can see the improvement in all her functionality. And now it is time for her to do all the exercise properly. Now, today we work in a digital environment. Digital environment means not only simulation, that we can do digitally all the simulation of the movement of the teeth, but also the monitoring. We can use several tools like Invisalign have this application which is called Virtual Care. There is a French company named Dental Monitoring. All of them allow us to do monitoring of the treatment actually every week. See, patient is sending us pictures, and we can see that everything progress according to what we expect. And this is not only the teeth movement, but also the function of the muscle, the function of the tongue, because if there is a good cooperation between the two of them, we will have the treatment progress as we plan. You can see here the picture I get from the application. I can see how the aligner fit on the teeth, and I can give the patient a green light to continue with the treatment without the need to come to the office every week or every month. I actually see my patients approximately every 2 months, every 10 weeks. So when I want to combine all my work on open bite from the orthodontic side, I implement inside all the work on the functional. And the functional means, first of all, to diagnose the behavior of the tongue. Behavior of the tongue is not only the posture of the tongue. We have to look at the size of the jaw, the size of the tongue. What is the relation between the size of the jaw and the size of the tongue, and see if we can actually place the tongue in the right position. If the patient cannot do it, we can move the jaw forward. We can send the patient to untie the tongue if the tongue is tied. And we can do a lot of things. So this is the first thing, is to diagnose what is the status of the tongue. Then I have created 3 different videos, which I send to all my patients. You can find it in my YouTube channel, Dr. Rafi Romano, or all the 464 viewers that we have today and all the others later on. I've created 3 different videos. The first video is why. Patients come to my office, they don't actually understand why they got this malocclusion, why the tongue is the problem. Nobody told them before about it, so they want to understand the whole concept of the functional environment. So I've created the video, which I explained very briefly why we have a problem of functional environment around our teeth. The second video I created is how, meaning we have the problem, how we do the correction of this problem. We have the Froggymouth, we have myofunctional exercise, we have myospots, which I will show you. We have a lot of things we do in order to correct it. And then I created a video, which is all the ABC or the 1, 2, 3 exercise that patient get a tutorial, get a special exercise, what to do at home. I know that some of the myofunctional therapists are not happy with this video because they say, you know, this exercise should be done only under our provision and under our eyes. But I believe that patient needs something also at home. So I created for them exercise which they do at home. They have really instructions to repeat the exercise 10 times, and then they go to the next exercise. All the exercise should not take more than 10 minutes per day, and then they can practice it properly. And then, of course, I give them these videos to show them demonstration of my dental assistant, who was very cooperative to show all this exercise to my patient. And then, of course, we have the Froggymouth. And I explain them that Froggymouth is probably like to drive a car. When you start driving a car, you have to think in the beginning, every time that you turn right, you have to operate the vinker. Every time you see a red light from the far away, you have to push on the brakes. Later on, you do it automatically. You know, many times I drive to work and I don't remember that I even pass through certain roads, because we drive automatically, we do things automatically. I explain them that Froggymouth is actually transforming their behavior to become automatically, which means it's only 15 minutes per day, but we are educating all the nerves and the muscles and the tongue for the new behavior. So if they will do it 15 minutes per day, following my instructions, sitting straight, head up, looking forward, only 15 minutes per day, and we keep calling patients to confirm that they are really following the instruction, then I believe that in every age, this is beneficial. You know, we can learn to write in our left hand, even when we are adults, if necessary. So we can learn to practice our tongue and muscles to behave differently. I believe that if we don't do it, my work as orthodontist is actually not full and not doing my mission to gain not only good occlusion, but good stability for the patient. So my assistant also give the video to show exactly how to use it, how to wear it. And we have a special leaflet that they get in Hebrew so they can understand what they should do. Of course, I show them exactly what is the natural position that they should sit. I tell them it's very easy because you sit in front of the mother or the patient and you show the mother, look at your daughter, how she's sitting. She's all her muscles are down, all her body is down. So no wonder that her tongue is actually leaning forward and opening her bite. I'm using also Myospot, which was developed by two very, very intelligent, nice dentists from Australia. There are many others options in order to, again, exercise the tongue and strengthen the muscle of the tongue. And I used also these little things here, which is called active retention, in order to get a better retention of the teeth, not to go up, even if the tongue is still pushing. We have to remember that the tongue is not, something that you teach and it disappears. We can usually improve the behavior of the tongue and the muscles, but not definitely correct it. So it's very important to have these things in order to maintain the result and maintain the teeth. So with that, I hope that I have explained the way we work in the office, and I'm very open now. I left, I hope, enough time for participants to ask questions, and I will be happy to answer. Guillaume, the floor is yours.
Thank you very much, Rafi. Of course, I am there. Thank you very much, Rafi, for this wonderful lecture. It was such a pleasure. I think that you are going to have here in a couple of seconds next to me. We were having a first question about the planning software. Is the software simulation taking into consideration the airway space?
Okay, so it's a good question because now Align and other companies are working to implement not only the airway, but also the CBCT in order to control the root position. Unfortunately, now, none of the software is actually having it. They are improving it. They want to take it into consideration. But, you know, I put into my plan the knowledge that we all know that if we expand the upper arch, we create more volume for the tongue. We create more opportunity for the patient to breathe normally. So, you know, there are things we know, even when we don't have the airway in the software. But I look at the airway always. I have airway analysis, computer analysis, to know exactly the volume of the airway, and I take into consideration this when I plan my cases.
First, my father loved to say about that, the airway space is the upper apartment. And if you are having an apartment of 60 square meters, you cannot expect to build another floor upstairs that will make 80 or 100 square meters. So you have to expand first down the palatal space to then have a bigger airway space. I think that there's also another very important question when we are speaking about this retain strategy that we are making a myofunctional rehabilitation for. When is, according to you, the best moment to make the myofunctional rehabilitation depending on the case?
Okay, this is a very good question. First of all, my answer is the timing to do your myofunctional involvement is the time that the patient enters your office. If it is the age of 4, if it is the age of 40, the minute the patient enters your office, it's your time to put it into his mind, to put it into the plan. And to me, it is important not to forget about the fact that we want, I disappeared here. Whoa.
No, don't
okay,
worry.
sorry.
You are still next to me.
Yeah. You know, as I said in my lecture, you know, I don't want to refer patients to do the treatment, the myofunctional therapy, and tell them, come to me later on. You know, they come to orthodontics office in order to treat what they see. And they see malocclusion. They see open bite. They see behavior, bad behavior of the patient functionality. So we have to do both of them. And I treat it even if the patient is very young, because the younger it is more easy for us to change it. So for me, the timing is not only because the bank manager my bank manager give me instructions to treat every patient, but I think the reality is the minute the patient come to your office.
You're totally agree with that. I think that the observation at the beginning, when you are seeing the patient for the first time, not even when he's sitting down on the seat, but really when he's stepping in the office, is one of the most crucial moments to be able to really assess what's the routine that he's having about all the myofunctional.
Yes. And one more thing, Guillaume. You know, if I can give one tip to the audience and to the speakers and to my friends, I tell them, look at the patient with your eyes and with your heart and show him that you believe in what you're doing. You know, if when we refer a patient to a myofunctional therapist or we give them the Froggymouth, they say, okay, you know, it's another tool, it's another, they will not use it. You want him, I tell him, I'm your like running trainer, I'm your dance teacher, I'm your whoever. You know, you cannot learn to dance only from coming to a dance class once a week. We have to be a team. So if the patient understands and I look in his eyes, do you want to be with me in my team? They will accept anything you give him.
No, Rafi, it's not just beautiful what you are saying, it is also very accurate, because I think that one of the first common points between aligners and Froggymouth, for example, is that as removable device, there is one rule. If you are not wearing it, the best device in the world will not be useful. So you have to get the cooperation of the patients. And for having the cooperation, you have to first believe in what you are saying and doing. So I think that you are bringing a very important point that is often not considered at its right value. A last question before the next transition is about the exercise that we are speaking. Could you quickly describe the exercises that you are asking your patients to do?
The exercise, okay. I think that the most important exercise is posture, is Froggymouth, and is all the strengthening of the lip muscles. Because when patient has a very strong lips, they will never have tongue thrust. Part of the problem is not only to exercise the tongue, which the Froggymouth is doing very nicely, showing the patient where the tongue should be. I think the most important exercise is strengthening the muscles of the lips, which we, I instruct the patient to do daily, and the posture.
Thank you very much, Rafi. For all the people that want to have more information about what you do, about the protocols, they can follow you on your YouTube channel. That is very developed. You are having a lot of videos in English where you are showing your patients. And as for all the other lectures, you will have a dedicated post on the Facebook group where everybody can ask his questions to you that we couldn't have the time to discuss in live, and you will be during the next few hours, days, weeks, answering all the questions that people might have. Thank you again, Rafi, for this wonderful lecture.